Yes.
Okay. All right. Well, welcome everybody. Let's get our meeting going. Welcome everybody to our executive committee meeting on Monday, August 11th. I'll call our meeting to order at 10:02 a.m. Marcy, would you like to do roll call, please?
I think you're muted, Marcy.
Yeah. Okay. So Melissa, I'll start with you.
Hey, Melissa Van Hook, committee and council chair.
Thank you. JJ.
JJ Rico here, CEO for Disability Rights Arizona and vice chair of the council.
Thank you. Vijette.
Morning, Vijette, sorry, parents.
Great. Thank you. Monica.
Monica Cooper, self-advocate, chair of the grant committee.
Okay. Kathy.
Good morning, Kathy Lewandowski, chair of the Work Plan Review Committee.
Thank you, Kathy. And Jana.
Good morning, everyone. Jana from Encircle Families, chair of the Systems Access Committee and committee member.
Thank you. All right. And Kelly, I have her marked as a no. Staff, I'll move on to John, please.
Good morning, John Myers, executive director.
Thank you. Lonnie.
Good morning, Lonnie Saints here, fiscal manager.
Thank you. Jason.
Good morning, Jason Singh, Research and Communication Specialist.
And Michael.
Good morning, Michael Leva, staff member and contracts and grants coordinator.
Okay. And then I'm Marcy Crane, and I don't think Sarah's on the call. Okay. Back to you, Melissa.
Okay. Thank you so very much. Agenda item B, our minutes review and approval from June 20th, 2025. Oh God, no. Oh my goodness. I hope everybody's had a chance to review the minutes. Before I call for a motion to approve, do I have any comments or questions or corrections that need to be made? Okay, hearing none, I'm going to call for a motion to approve the minutes from Executive Committee for June 20th, 2025. As written, do I have a motion?
I'll make a motion. This is Jana.
Thank you, Jana. Do I have a second?
This is
I'll
Vijette.
second
that.
Vijette. Okay, I heard Vijette. Thank you. Thank you for that.
That's okay. That's all right.
Thanks, Monica. Thank you, Vijette. All those in favor of approval, please say aye.
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 All those opposed? Oh, sorry, Jenna. All those opposed, please say nay. Is anybody not voting? Okay, thank you. Motion carries. Okay. Agenda item C, our federal fiscal year 2026 annual work plan overview with John and Marcy. And if there were other staffers on there.
Okay. Thanks, Melissa. Marcy's going to be doing most of the talking. I think Mike is also going to share some. I just wanted to start with a little note that I think everybody's already aware of, that we are proceeding with our work plan for next year with a knowledge that we have received our notice of award for fiscal year 26, and we are essentially at level funding for next year. And as we proceed for future years, at least for the following year, we believe we will be at level funding for fiscal year 27 as well. I should explain that we are written into the proposed Department of Health and Human Services budget for next year at level funding for where we are now, which means that we will have money to spend in fiscal year 27, assuming all of that money is approved as it is currently presented. Those who are representing the PNAs and the USEDs are also in the same boat as us. We believe it's going to move forward at level funding. It is not signed into law yet, but that is the way it looks to be moving through Congress. So that is why we have confidence that we're going to have the funding we need to support the programs that we've written into the plan for next year and then for the year after. And the second note I would make before I turn it over to Marcy is For fiscal year 27, as everybody knows, that's the first year of our next 5-year plan. So some of the projects that we are proposing for fiscal year 26, if they are new projects and not limited to a single year, they are intended to be projects that can transition smoothly into the next 5-year plan, regardless of what our goal areas are. And I'm not sure that makes sense, but again, as you all know, we have to develop new goals and objectives as part of a new 5-year plan. But we can't just start from scratch with doing solicitations for grants. We have to have some things that are already in the pipeline, some things that are already being undertaken. Otherwise, we simply won't be able to obligate the money that's made available to us. So we had to try and come up with some projects or contract for some projects that can transition from one state plan to the next state plan, and that are, I don't want to say generic enough, but that are flexible enough, maybe, that whatever the goal areas are, if they're even remotely similar to what we're doing now, these projects can transition into that next plan, and they will fit within one of the goal areas and one of the objectives that we come up with. Again, I don't know if I'm making sense enough, but Marcy will probably explain a little bit more as she details some of the projects moving forward. I just wanted to put that note out there so everybody knows that for the new projects that we're envisioning, they most of them likely will be moving forward beyond 1 year, and they will somehow fit within the goal areas of the new state plan. Anyway, I'll stop talking, turn it over to Marcy. Thanks very much.
Okay. All right. Thank you, John. So in front of you is a very small print annual work plan. I have mine blown up on my personal laptop to go through. I just want to notate a couple things. First of all, this was a work plan that everyone worked on the last couple of months to try to get this in place for the deadline, which is the 15th to ACL. There's other things that ACL requires as part of their August 15th date. And we're going to have a meeting to finalize and review everything, I think this Wednesday with John, and then hopefully make any minor changes and then submit everything that the feds need. So the other thing I also want to highlight is what you see in yellow is two things. It is probably a couple things. It is contracts that the council has already approved this past summer per your minutes, per this time, such as the very first program, which is what you see, Arizona Achieve, which is a contract with the Arc of Arizona. There are contracts that are highlighted that are in the works. As John just stated, we had to identify with the pot of funds that Lonnie has been speaking about. We had to identify quickly some new scope of works and projects to kind of figure out. Those, you'll see them notated with a proposal is going to be submitted sometime this month so that staff has a chance to review it and provide some feedback back to that entity who is submitting in the proposal, and we hopefully have that information finalized for the council executive and full council next month. So those contracts, if they pass, will all be in place by October 1st for a 1 year. And then obviously we'll be transitioning over into the new work plan in some format, because we don't know what you guys or the full council will look at in terms of the goal statements, the number of objectives, and what area of emphasis and so forth. That's something to be decided later on. And then there are some other generic notes that are also highlighted in yellow to kind of assist staff with some background information and maybe some other things that will be highlighted for us to kind of keep track of. So, but this will go through, if approved, through September 30th of 2026. There will be a final PPR report submitted at December of 2026 based on this information and what the council did, and then a whole evaluation of the whole 5-year plan, how well the council did. So there's going to be a lot of components to do in that big PPR report. Okay, so to get started on this, again, I will let Michael cover employment, and I will cover the other four goals. So the first one, objective on the self-determination, is just one activity, which is Arizona Achieve, which is the contract for our mandate to meet the self-advocacy. We had this contract renewed for the third time this past summer, so it's running smoothly July 1st. Becky King is the new person taking over from Ryan Berry, and she just had a meeting last Friday with their self advocates. She has a very well put together newsletter that she's doing. She's doing a lot of outreach, and hopefully to keep the minimum of 25 self-advocates and increase other self-advocates to join and support other local self-advocacy groups. So we feel pretty good about that. On the left column, let me just quickly kind of give an orientation as to how we put this together for folks. So the first column is your first activity. Below that are the performance measures that the federal government requires. They're all by code. So there are code numbers for 25 self-advocates, and then the percentage of self-satisfaction and increase in self-advocacy and so forth. We have to include also output statements and outcome statements, as well as the type of evaluation methods that this activity requires the grantee or staff to do. So we try to put as much information in here. We know that with our contract, they all do a narrative report, but within that narrative report, they have to do, thank you, Vijay. Yes, I think that's Monica's. If they can also list for us in their report how they're gathering that information. So we do know that Arizona Achieve is doing pre and post surveys with their self-advocates. They do a number of meeting minutes as they have meetings. They also hand out questionnaires. They do sometimes little small discussions or interviews with folks. So we try to put as much information in here. The last column is updates, is really when we meet quarterly as staff, we provide updates in this last column. So you'll see some notes in here that are going to carry over. The second objective is still under self-determination, but it is also to support self-advocacy, but in the larger context to support a number of different projects over the years. The first one being supported decision-making, awarded for $70,000 for its third year. The council just approved that contract. It's in place, running through the end of 2026. What is going to continue on and what is new, there's just a couple things to highlight. They're going to continue their trainings for online and in person, but they are also developing, and did this in the last quarter, their train-to-trainer model, which is what they hopefully will have in place to sustain this project, so that they have a number of folks who can now take support decision-making on the road, learn the PowerPoint and the information and in the context of who they are targeting for these trainings. Therefore, you see SC14, which is the number of people trained, is 250 people that they anticipate training around the state. And that is inclusive of the train-and-trainer model. 100 parents, caregivers, 25 self-advocates, and then the rest of them are all just other numbers based on the performance measures. So we feel really good about that. We're glad to see that they are looking at some sustainable model to keep that program going, since the council has been instrumental in it. Couple of things too highlighted here. You'll see this throughout this. There are a number of activities that we are dropping off this year for a variety of different reasons. And for the next one, number 2, this was really around the conference sponsorship. We are no longer putting funds towards conference sponsorships. The last 3 that were awarded just ended their contract June 30th, and we did not issue out a new solicitation. There were no new funds going out. Felt it was better to drop it since we were not awarding a number of large organizations for it. And so we weren't getting good applicants, to apply for it either. So that fell off, and you'll see that scratched out entirely for all its information. Number 3 is also, next page, has also been dropped off. This has already been completed. Staff with John and Sarah did the community survey, and they are use that information to enhance some aspects of the staff resources and how we move forward with the data that they applied. And so that is dropping off as well. Number 4 is around the council-led activity, around the number of occasions that we kind of help self-advocates, provide an opportunity for them to speak at public policies or with legislators. This has carried over for the last year, perhaps, and it's a good way for us to work with Arizona Achieve, and because they have to do leadership development, we want to ensure that self-advocates are given an opportunity to speak at different various events, so we also provide assistance and we track what they do on that manner. Number 5 is it just changed in terms, this was Sarah's project, which is the Arizona Disability Speakers Collective. She changed the name. She is moving forward in the phase of developing a formal process and training. She's partnering with Arizona Chief Self-Advocates to be a part of this. And she is going to, hopefully, what this is around is self-advocates will be chosen to speak at different engagements that we get calls on saying, can someone speak on this topic? Can we have someone like John speak at a particular event, or Jason, or is there a self-advocate? We always want to make sure self-advocates can participate. So we created this activity, and now that it has a formal name, it's just to be formalized and tracked. And Sarah's going to move forward in that phase. And so she's going to make sure that she follows through with the evaluation as well. We need to make sure that we track those numbers and find out how well they're doing. Number 6 was deleted. This is a good thing. We finally have the legal options manual updated. Thank you, JJ Rico, and for your staff's time in that. This was the contract with Sonora and USAID, and then part of it went to DRAS to help update the legal options manual, which we now have. And if we've also been handing them out, it's been translated into Spanish. So this was finally completed, and we'll be able to report that in the PPR. The last one, activity number 7, is highlighted. This is a potential new project that we are in conversations with the Sonoran USAID. We have a discussion with them around scope of work to address support decision making in the healthcare professional system. They are going to create a couple things out of this proposal from what we were able to see in a quick summary for about $35,000. They are going to assess and do a survey of administrators of healthcare professionals on what they know about support decision making and if it's in their guidelines or policies at that level. If not, they're going to create a training and PowerPoint and educational aspect to this to start rolling out support decision making in the healthcare community specifically. And so we are awaiting a full proposal with kind of spell out how they plan on implementing this, who is staffed. It's going to be due August 28th. And so we'll see how this looks, but this is just for healthcare professionals, medical doctors, practitioners to kind of be more affiliated or be knowledgeable on SDM. And so you'll see an outcome and output statement that was created based on the summary that we received from Sonoran Center. So we want to make sure that healthcare professionals will understand the importance of SDM, utilize this approach with their patients, and they hope to train 25 individuals. Any questions on this first goal and the changes?
I don't have any.
I don't either. I kept trying to be quiet and everybody kept muting me, but I don't have any questions.
Thank you. Okay, I will turn it over to Michael to cover goal number 2.
Thank you, Marcy, for that lead in. The Meaningful Careers Committee met a few weeks ago and we reviewed the work plan. Originally, we had 15 activities and we thought that 15 activities, while they're good, some of them were duplicative and some of the projects had been completed. So we pared it down to 8 activities. In the first objective, there are 4 activities. They focus on promoting dual enrollment. We had a really good policy brief that was prepared this year. And so we want to work with schools to advocate for dual enrollment for students that have intellectual disabilities. Oftentimes, dual enrollment is something that's exclusive for advanced placement students, which is good. But our students, our kiddos, never have that opportunity. So we want to make sure that we promote that opportunity. We also want to work on lowering the transition age from 16 to 14. when the Institute for Community Inclusion prepared the report to look at the services, the gaps that were that were offered and provided by the vocational rehabilitation division. One of the most important things included in that report is that transition planning should begin at a much younger age. So we're going to be actively promoting that. And JJ, we're going to be working with Amanda Glass from your division, from your agency, to see how we can do that. There's a new activity, and that is to see how we can expand Project Search. We're going to be working with the Sonoran Center to look at expanding high school-based Project Search site, and we're going to be working with Kingman Unified School District to establish that. So in the work plan, we are allocating $18,000 for a licensing fee. The council will provide that funding, and that money goes to Project Search for technical assistance, to maintain program fidelity, for resources, for all of the licensing. And then once that fee is paid, that licensing fee, there will be an annual renewal fee, which would be the responsibility of the high school in Kingman. In the second objective, we are going to be working on a project that we started this past year, and that was a really good collaborative partnership with the Arizona ADDPC chapter, with the Sonoran Center, and with the Colorado Office of Employment First. For the first time, we did a survey of employment support professionals to find out who they are, where they are, what they're doing, what kind of education levels they have, what kind of experience they have, how many of them are actually providing competitive integrated employment for their clients. And so as a result of the survey, we had a really good base of information. And there was also a report that was generated. And in that report, it offered some recommendations on how we can continue to have more successful employment outcomes. And so some of those include establishing a digital hub, navigating through DDD and VR. And so we asked the Sonoran Center if they would take the lead on that project and work with the Arizona ADDPC chapter to see how we can implement the recommendations that were included in that report. We're going to continue to work with our partners to promote National Disability Employment Awareness Month. However, this year we've established a great relationship with the governor's office. The governor has created a workforce cabinet on employment. And so we're going to be working with them to issue a governor's proclamation, to issue a press release, to look at conducting a virtual employer forum. And then there's other activities. For example, on October 30th, there's the Dream Fair, the Dream Job Fair. And so we've asked the governor to provide welcoming remarks because there's going to be a lot of media there. Last year, there were 541 participants at that event. So we think it's a really good opportunity to showcase the governor as the state CEO, as the state's leader in employment, and as a state's leader to promote inclusive employment. We're also going to work with our partners who conduct trainings for ABLE accounts, Achieving a Better Life Experience, and Disability Benefits 101. While those presentations are good, they're just canned presentations. They need to be upgraded. They need to be enhanced. The council is going to take the lead this year to coordinate and to coordinate more training sessions, to look how we can expand the marketing materials to make them more consumer centric, to make them more easily available to families so that they understand the benefits of these two programs. So we'll be taking the lead working with DB 101 and ABLE. One of the projects that we had discussed last year, and I want to just give special thanks to JJ, because when we were talking about establishing a leadership development and advocacy skills webinar series, it was a great idea. We wanted to hire a incredibly gifted national speaker, Alan Bergman. But when the administration started to make announcements about cuts and everything, we put that project on hold. And so we've decided to hold off on that project until, until the time is more appropriate. So I know I've gone through this fairly quickly, but we have 8 activities. I feel confident that we're going to do a great job with all of those activities. I really appreciate the support that we received from Disability Rights Arizona, from the Sonoran Center, from our partners. We've established excellent working relationships, and we're going to continue to just make those relationships better and to produce some really good products. So I know that was pretty high level and pretty quick, but if anyone has any questions, I would be more than happy to answer them.
I just have a comment, Michael. I really like that we're going to focus in on DB 101 and not just have a CAN training. I think that's the best thing we could do there. So thank you.
Thank you, Kathy. Melissa, did I cover everything? Is there anything that you wanted to add or touch on?
You did a great job. I think you got it all, Mike. Thanks.
I also want to thank our committee. We have a great committee, and they're very supportive, very enthusiastic, and contribute a lot. So thank you, committee members that are here today.
I would echo that. Thank you.
Thank you, Marcy.
Okay, thank you, Michael. Moving on to number 3, the inclusion with engagement. A couple changes here. So the first objective activity we are deleting. This had to do with partnering with the DES refugee resettlement. The Sonoran USAID. In the past, we had a contract with Sonoran USAID to do a refugee report, which was done and completed. And so that was already been reported on. And this was around creating a way to create accessible resources. There's just been a lot of changes within the DES resettlement office. We know there's obviously changes coming from the federal government. We don't think we could really do a whole lot around this area. So you'll see later on, there's a proposal from U of A that the council staff is reviewing, in the process of reviewing, regarding resettlement and still working on the project, but in a different aspect, not so much developing resources, but we'll get into that when I come across it in the plan. So this first one is going to be scratched out going forward. The second activity we are keeping, I refer to this one as all the constituent calls that our office receives, and staff are charged with addressing, whatever the caller is needing, and we track that. We obviously have more than 12. That's just a minimum that was just kind of established years ago. But we do keep track of all these calls, the resources that we provide to them. Sometimes Sarah and Jason do a lot more. They follow up with them. They contact other state agencies to kind of figure out how to get them the information they need. So it's really helpful to keep this so that we know what some of the barriers that the community is facing and how we can address it. So it's been pretty helpful to have, and that will continue. The third activity is around the data hub. This is on our website, our contract with Alex Curse at ASU. We have spoken to Alex several times this past year. He is okay to do this for a lesser amount, for $10,000. And the reason being is because he just did a whole updated on the census this past December. And he also went ahead and included the data from DDD, and that was under our agreement with DES. And that agreement is in place through April 30th of 2028. So really, he's going to help two interns, I believe, to help assist them. And it's really to do just the maintenance of the data hub. And even though this contract began in 2023, every year it will be renewed through a no-cost extension, and then something for the council to keep in the back of your mind to consider how you want to move forward with maintaining this and support it, so forth. So that will go through. Let me see here. Jumping to objective 2. We updated the language on the activity for the first one. This is Jason's project to support the transportation innovation funds. These are new funds going to the Arizona Department of Treasury with ADOT, specifically to address the lack of transportation access in rural communities. About $2 million or approximately in that funds for nonprofits and NGOs to apply for. Jason is going to keep tabs on that to figure out how those funds are being distributed, who are they going to, and make sure that he can provide any guidance if necessary in terms of making sure that they consider the barriers that people with disabilities face in transportation. So everything got updated here where it said output was updated, outcome statements were updated, and then additional notes that Jason provided. So appreciate that. The second activity is also an activity that Jason will take the lead on that he's been working with Maricopa County of Governments. It's an implementation of a pilot transportation project called Telehubs. And basically he attends those meetings, and it's really around providing technology in public libraries for individuals with IDD to access. And so he will continue to attend those meetings and find out how well this pilot program is rolling out. So we'll include that in our work plan and in our final report. The third objective speaks to a couple of updates. The first one is an activity update that the council will create and share new resources around healthcare to educate healthcare professionals and promote inclusion. What we plan on doing here is, this is the activity John's been working on for the last couple of years. He's taken a lead with other collaborators to ensure that healthcare professionals in Arizona have knowledge about IDD, especially with what their concerns and their needs are, their caregivers and providers when it comes to key healthcare decisions, affecting their lives. There are meetings that it goes on that he attends, and so we're keeping this whole thing in place. It kind of fits nicely with another activity that follows in systems change with healthcare and people aging over 50, as well as if we could get the support decision making and U of A project in place. So we'll work on that one. The next couple activities are deleted. One of them had to do with staff helping to create 4 videos and translate them into other languages. It became a little bit of a barrier to kind of complete that in place. And so we are scratching that. It's in place to finish up for 2025. I believe Sarah and Jason are working on the last couple of videos to do by the end of September, but no longer will be carrying this over into the next fiscal year. And then the following one, 1B, says the council will utilize the funding from the community survey. That's already been done. No longer necessary to carry that over. So that one is scratched out. The next activity, number 2, is a rewrite that council will continue to educate the communities and education organizations about the new state requirements related to emergency operations planning. Really, this is around local school districts. This was legislation that passed a couple of years ago. We are still going to work on this, maybe not so much directly with the Department of Education, but more with local school districts and stakeholders such as the PTAs in Mojave County and Surprise School Districts. I believe there's been some good leads there that staff has had. So we know that they have to have an emergency operation plan in these schools, and we want to ensure that they have this information. And so we'll be creating some awareness campaign and education materials to share with them. So that will continue into the final year. The next one, 1D, is scratched out. This was a grant that we funded for 2 years with U of A, NAU, and ASU. This was the expand the programs to educate and support women with disabilities on pregnancy and parenting. So this was a 2-year grant, and it ended this past June. I should just say that U of A will receive a no-cost extension through September, but for the most part, this project was funded by the grant, by the council, and all 3 were supported by grant funds, and we will report on it in the PPR. And each one did various different things, so we're very pleased with the work. Hopefully we could get ASU to do a presentation to the council at a future meeting. The next activity on the next page, 7, number 3, says the council will support and expand the Atlas CPC program. This is a new proposal that we're in conversation with NAU at this time, and we are awaiting a full application that's due on August 20th for $50,000. It's going to be a kind of a compilation between Atlas and CPC. Atlas just ended this June 30th. It was to provide assistive technology to the college-age students with IDD and really have them understand how to advocate on behalf of themselves, what sort of assistive technology they needed, how did they maintain it, how did they use it. So Atlas was really around assistive technologies. The CPC program was funded by the council for 3 years as a pilot, and it was around creating college experience for those kids coming out of transition in high school that wanted to go into college but needed additional supports and services, and really training administrators on how to support them. And so this is kind of taking both of them together, and what they plan to do is provide high school students with IDD to learn about assistive technology that is available to them and help them in their ongoing transition needs. So it'll be a 1-year project if the council supports this, coming up next month. And the last objective, which is a mandatory objective for all councils to do, is around emergency, what they call an emergency objective statement. We don't put any specific activities, outputs, or outcomes, just a statement that the council will collaborate with Arizona Department of Emergency Military Affairs, Arizona Silk, to understand and prepare for the needs of Arizona with disabilities in the event of a public emergency or natural disaster. So at this time, the feds just wanted a statement or an objective, but not anything else related to it. Until we hear further how they're going to roll this out, then we'll provide more information as needed. So that is basically the changes in inclusion. Any questions?
It's all very good.
All right, thank you, Monica. Thank you, Kathy. All right, moving on to safety. Okay, first activity under the first objective. The council renewed the ops training, which is NAU's online privacy and safety training, for the 2nd year. They are going to make this a sustainable project now that it was a pilot the first year, where they received a lot of feedback from families and for self-advocates on how to stay safe online. And they went through different modules and different trainings, and they rolled it out as young as, I believe, 14-year-olds as well, to get their input. As we know, everything is moving online. We want to make sure everyone stays safe as they, live their lives online. So this will be a great project to see this sustained and eventually on their website, so that it's accessible to a larger community. The second project is, well, there's a lot going on with this one. I guess to kind of, you'll read my notes everywhere in yellow. John and I had a lot of great discussions around this. Basically, this is the contract with the Sonoran USAID to really take Lynn Tomasa's report that she released maybe about 1.5 years ago, 2 years ago. It was called Sexual Violence Told Through the Lived Experiences of Survivors, Families, and Professionals, the Impact of Sexual Violence on People with IDD. This is the contract that's been in place for right now 1 year and into September. Unfortunately, there is a couple of concerns that staff has had with the contract in regards to 2 or 3 specific activities related to policies and working with state agencies, DES, DDD primarily, to kind of make sure that they can move forward on some recommendations outlined. And it has not been too successful in that aspect. So we asked for a couple of things, you know, per contractual agreements. Is we wanted to make sure, how do you get back on track? What do you plan on doing differently to get back on track? And then eventually we moved into the phase of, let's ACES-DV as part of this collaborative. Would ACES-DV and U of A be able to partner in a more collaborative role and identify specifics that ACES-DV could do on the policy side, where Lynn's strength is really around research and data gathering and how to merge the two together for a successful program. The big concern out of this is to make sure we do not lose the momentum that has been established by Dr. Tomasa and her team, but we don't want to lose the focus of policy work either. And definitely we don't want this contract to not fall through the cracks and not be renewed or extended in some way where it falls off of the work plan completely. And so ACES-DV, U of A, and John and myself had a conference call last week. We worked out some requirements that we would like to see how they would both work and partner. They are going to submit a proposal on what that will look like and what each agency's role would be and what the responsibilities outlined. And we hope to receive that proposal by September 10th, I believe, is the date that I asked them to submit something to the office so that we can review it. We want to ensure that the scope of work, which is around a committee to work with Dr. Tomasa to ensure that this work continues on and that oversees the resources and materials that have been developed over the previous years with the ARC of Arizona, which took a big lead on that in the previous contract year, still continues and gets updated and shared. And then the last 2 pieces of this scope of work was around policy development and start looking at how do you make this a systems change effort. And this is where we felt that Dr. Tomasa is going to need a lot more support, and ACES-DV agreed to do that since they have a lot of strength in policy development and systems change and working with the legislators. So we'll see what this proposal looks like coming down. But, you know, I just want to say on record, you know, we appreciate Dr. Tomasa and her team on doing as much as she could around this. And we want to see that the work continues in the different format. So more on this to come. Number 3 is around John ensures that DDD members are informed. So we have a number of things that we do around this. We provide information to DDD members via our newsletter and social media. John has calls with DDD director, you know, to kind of chat with things and, you know, if anything that he sees percolating on his end that he shares with them. And so that information is tracked and we report that. And this is just a good way to just keep in communication with DDD. Number 4 is around supporting a policy change to promote the safety of people with IDD. The activity is going to change a little bit. We're going to center around Jason's work on the criminal justice report that was released about a year ago that he had worked on with a professor with Embry-Riddle. So it's going to center on the criminal justice supports for individuals who are involved in the criminal justice system and who have a disability. So we want the policy to focus on an improvement to benefit people with IDD who are involved in the criminal justice system and that they receive the proper services and supports. And so we're going to switch this a little bit to ensure that we continue to work on this area that Jason has spent a lot of time on. The 5th one is deleted. This was around the Grand Canyon Collaborative, which no longer exists. This was federally funded. There's no more funding from the Department of Justice, so this kind of went away. And so we're deleting it out of our work plan. This is the work around they did abuse, neglect, risk factors. So it kind of went parallel with some of the previous work that the ARC did with our funding and that Dr. Tomasa now is doing based off of her report. Number 6, coming down to page 4, we are updating this activity to read around state agencies, provide state agencies with technical support and training in identifying individuals with IDD by developing a statewide screening tool to ensure the ADA rights and accommodations can be met while individuals are serving in the criminal justice system. Again, this is a tool that Jason, some sort of screening tool that Jason will work with other partners to ensure that there could be one that will be used as folks are arrested and are held in jails and detention centers. They're screened for a lot of things, but one of the things that they're not screened for is if they have a disability. And so we want to make sure that he's been talking to folks at the prosecutor's office, different prosecutors' offices, and DOC, Arizona Department of Corrections, that, really how do you begin to identify and create a screening tool to help folks who are in the system be recognized and be afforded their rights, their ADA rights and other services and supports. So exciting to see this one as well. Objective 2, a couple more changes. The first one is a renewal application we are expecting to receive from the Sonoran Center around their work that they've done around crisis response and trauma-informed care. We have this application due this week on the 14th for a second year. So that would be reviewed and be presented in front of the council. It would be a summary of their work they've done to date and what they plan on doing for this second year. So that will continue. And then the second activity is completely deleted. So we'll just leave that one activity. So any questions on, let me just explain why number 2 was deleted. It got wrapped into the first activity. It was kind of duplicative. We wanted to ensure the second activity was around, again, improvements and shortcomings in behavioral health and crisis response, where it was going to be focusing on first responders and law enforcement. We want to and make sure that JC's work around her program, which she proposed, included this aspect. So it doesn't get reported twice, but gets reported as a comprehensive project that she's looking at. So that's why it got scratched out. Okay. Any comments to safety? Hi, JJ.
Hi, just a quick comment for Jason on the kind of continuation or expansion of the kind of law enforcement kind of screening people for disabilities. Obviously, I support it, and I think that in light of the most recent executive order to incarcerate or forcibly detain and institutionalize people with disabilities and people who are unhoused might also be wrapping or kind of rounding up people with various disabilities. So I think it's more important than ever, and Jason maybe just expanding on how they do it on this, if we start seeing this happening on the local level or even nationally, just kind of, again, another reason this is so important that people are correctly identified in either not incarcerated or institutionalized if that's not the services they need. So just kind of a side note, but this executive order that just came out a few weeks ago kind of concerns me, especially those with co-occurring disabilities. So just kind of put that on your radar, Jason, as you continue to work on this. Happy to kind of fill you in offline if you need more information.
JJ, can you share that executive order with staff, please, when you get a chance?
Sure, I'll put it in the chat now too. So.
Great, thank you very much. Definitely.
This is Monica. Can I add, how are they going to manage, like, if they need assistance with understanding what they're saying, not only with the attorney, but, maybe they themselves as people with disabilities, for example, when they're being questioned, they don't understand the questions.
Yeah, that's one of the things we're looking at as well, on how to do that the best. Right now, each county does it differently because it's localized. So it's just trying to figure out the best way to do that, to make sure that the person is understand, from a victim perspective and a person that's going into the system. So it's a full circle kind of thing. Does that answer your question, Monica?
It does. Thank you.
And I will definitely reach out to you, JJ, about anything you want to add regarding the project as well. So.
Okay, very good points. Thank you. Okay, moving on to the systems The last one, our goal is systems access and navigation. Make sure I've got it up here correctly. Online. Okay. So a couple things on this one. The first one was, the first one is around developing and expanding access to timely information around the DD server system. We are keeping this activity. This allows us to attend a number of different events that we are asked to attend. And it's a great way to keep sharing the different information from our partners and any new information that we have or new reports. Obviously, the legal options manual is a big one that folks like to grab. And so even though it says 4 events, we track a number of them, and we hope to get out more into the rural communities. So if you know of stuff that's going on in a different community or the tribal community, let us know so that we can participate. And it's a great way to share information and kind of make sure that we also hear what's going on in the community as well. So just a way to keep that in place. We continue to participate in those. Number 2 is completed, and we are taking it off of the work plan. It's the how-to guide that has been worked on for a number of years, but is on our website. Thanks to an intern and Sarah and Jana and your work plan committee, that had this in place and looking at different ways. So it's a electronic how-to guide with a lot of different questions for people moving into Arizona, and where do they go for resources? Who do they contact? So that's, like I said, live on our website, and we're just removing that from this work plan going forward. The third one under this objective is around John's work on the bridging disability and aging community of practice. We are keeping this because obviously there's a lot of support for it. And John, you might correct me. I'm not sure if this is the one that's funded from NACDD, but John does work on there's 4 different work groups, and they meet every other month. And so they are addressing this, and we want to make sure that this is a part of this work plan.
Yeah, that's correct. This is a special grant from ACL through NACDD.
Okay, ACL. All right. Number 2, the second, out of the second objective, we are deleting this project. This is around the research report, as I stated earlier, that we had funded a report with Sonora News said about refugees. It has been completed. We are not carrying this forward in this manner, but it's stated a different way in what we're doing with refugees and how we're still going to keep our thumb on this topic, because we do feel it's still important as an unserved community. So the report has been shared, and now we're moving on to a different phase. Number 2, continue to collaborate with key partners, expand health access, health equity. This is a project John has been working on for quite some time, and you'll see all the different folks in that last column that he works with. Southwest Health Equity Research Collaborative with NAU, the Southwest Center on Resilience and Climate Health at U of A, Health Equity Partnerships of Arizona, with Mayo, ASU, U of A, NAU. And so still feel, again, healthcare is a very much important need in these unserved communities, and John will continue to report on that. And then here's where we wrote in the possibility of funding the type of refugee project that will kind of go forward based out of this report. We had a couple of conversations with Julie Arman and JC Farkas at U of A about a navigation system for refugees. And they want to focus on Pima County specifically. They kind of gave us an overview with a different dollar amount. And so we had to reframe it a little bit more tailored so that it could be something that could be funded within the dollar amount that is available at $35,000. We did get a proposal in. Staff is going to meet and review their proposal tomorrow to kind of see what additional information we may need for them, and possibly relook at their budget again. It came in a little higher than 35. And so I can't tell you anything more about the navigation model, how they plan on doing this or what this means until we have a chance to review the proposal. But it's something that they are choosing to kind of focus on to make sure that there is still some work around sustaining a project for refugees that are in the state that need services, that need support for their communities as they are trying to transition into this country. And so we'll update this as we get more information in on this proposal. And then the last objective, which was a mandate for the council that will fall off at the end of this final year, is the targeted disparity, the contract we have with U of A, and it is around the contract for the Native Disability Center for $120,000. We are expected to receive their final proposal at August 22nd, which should wrap up this work around all the different resources and services for the Native community in Arizona. They do a lot of outreach, webinars and training, and a lot of other tribal communities from around the nation attend these webinars that are put on by U of A. But the other important aspect to this is around ensuring that youth on the Navajo Nation that are in transition or have an IP and transitioning into employment options have that support and services for them on the Navajo Nation. So that really was the targeted disparity, was ensuring that they are able to still work with youth on the Navajo Nation as they transition for employment opportunities. So it's a bigger project, but then they have a little key focus on Navajo youth. And that is the end of objective 3, as well as the last goal. Any questions on this particular goal?
I don't have any. Thank you.
Okay, thank you. Kathy.
Me either.
Thank you, Marcy. That was a lot. Thank you for sharing all of it.
Sure.
Agreed. Good job, all staff. That was a lot of information, but thank you. Okay, we do have to, as an executive committee, approve this so it can go through to full council. Staff, if I'm wrong, please let me know. Okay, we're good.
Actually, sorry, Melissa, just a correction. It needs to be approved by executive committee so it can be submitted to ACL this week.
That's
The
right. That's
Executive
right.
committee is acting on behalf of the council as a whole.
Okay, that's right. Sorry, because we don't have another full council meeting to approve this. So thanks for the correction. Okay. So I'm going to ask for a motion to approve the federal fiscal year 2026 annual work plan overview, or annual work plan as we just reviewed it. Do I have a motion to approve the work plan?
So moved.
Thank you, Monica. Do I have a second?
I second. This is
Thank you.
Kathy.
Thank you, Kathy. All those in favor of approval, please say aye. Aye.
Aye.
Aye.
All those opposed, please say nay. Is anybody not voting? Okay, thank you. Motion is approved. All right, agenda item D. Do we have any announcements? All righty. Agenda item E, call to the public. I don't note any public members here. Okay. Agenda item F, let's adjourn, everybody. I hope you all have a great week. Thank you for making time for this meeting this week. Thank you, staff, for your great work. Thanks, guys.
Thank you
Bye,
to all.
everyone.
Thank
Appreciate your
you.
help.
Have a good
Thank
weekend.
you.
You
Bye.
too.
Bye.
Bye-bye.